Hey everybody, today we're going to talk about catheters after SCI, spinal cord injury. Fisher, for a while I used a catheter.
Yep, I don't know how long ago, like a few years.
For 4 years I used a Foley Catheter. Today we're going to talk about catheters after spinal cord injury, Fish.
Yep, he used one for 4 years after his accident.
I used a Foley catheter for 4 years before I started down the journey that I'm on now. And first off, a Foley catheter obviously is a catheter that is indwelling and it stays in. Usually people leave them in for around 30 days. And then you have the ICs, which is catheters that both male and female use to drain their bladder about every 4 hours. It's a disposable catheter that they throw away after that point. And so we'll go into the realm of catheters right now, Fish.
Yep.
A Foley catheter, as I said before, is an indwelling catheter that stays in usually on an average, I'm guessing around 30 days. That's what mine stayed in. And honestly, after most patients have a spinal cord injury, especially quads, that's usually what the rehabilitation hospitals like the Shepherd Center start with, is a Foley catheter, which comes with some positives and negatives. If you don't have hand function and you're unable to give yourself ICs, or if you don't always have 24-hour care and you can't give yourself, they can't help, your caregivers can't help with ICs, then the Foley catheter usually has to be drained once a day. It measures your output. And so there are some positives to the Foley catheter. If you have filling as a male, I can only speak as a male. I know I never lost filling in my private parts, and just to be honest, it ripped me a little bit, and it was always pretty painful, right, Fish?
I don't know, but I bet it was painful.
It is. It can be painful if you have filling down there, and probably that's when I had my most UTIs. Urinary tract infections. Sorry about that, I can't talk. I had them quite often with the Foley catheter. Had that from 2010 when I had my accident to 2014 to a trip to Shepherd Center. And then we started trying to get me to IC. By then I had good hand function enough to do it. ICs are intermittent catheters. I'm probably not saying the first word exactly right, but it is a catheter, again, both male and female can use, where they drain their bladder, usually on average every 4 hours. It is a disposable catheter. And obviously that gives you a lot of independence. One of the main reasons that when I went to the Shepherd Center in 2014, I started dating again, and obviously sex was on my mind possibly in the future. And so that was one of my main reasons of seeing if I could do it, to be honest with you. And when I first started doing it after 4 years, when I was there, it was a disaster. And once I got home, I continued to work on it, and it continued to be a disaster. But after about 1 month of being home, so that would be around 2 months of doing it, I started noticing that I could tell when I had to use the restroom. And so I quit using ICs and just started using a urinal. And so long story short, 10 years later, I am now, 100% got control of my bladder. And, to say I don't have an accident, accidents are very rare. But what I do use is a pad. Take that out, Fisher. It's a male pad. It's an Equate. I do use the maximum protection. It's a male pad.
Open it up.
Yep. And it does that. And like I said, it does come with, I do not use this feature, but I'm guessing female pads have this too. It does have a sticker that you can stick on your pants. I do not use that, but this is what they look like. I use Equate or Depend, whatever one they have, maximum protection. I will put that in the description below. I use them every day. I change, sometimes one a day, sometimes twice a day. That just depends on the amount that I dribble, right, Fish?
Mm-hmm. Because you don't want the dribble to get in your pants, and that blocks it real good, right?
Yep. Does a really good job. They really are good, easy to maneuver, so they're really good. And then, there are times that, if I am having a little bit of problem from time to time, then even, when I get in my recliner or bed, wherever I'm sleeping, then I use Equate pads. You can go ahead and spread that out, which is just basically a disposable, bed pad. That is the large, is what that is. And they are around $6 for, 15 of them. And the male pads that I just showed you, they're around $10, but they come with
50.
Like 50 of them, so they last a long time, over a month usually. So when we look at the Foley catheter, Fisher, we can say that they have a positive that if you don't have good hand function,
yep,
they're permanent. No time for the kitty right now.
No time.
No time for you, kitty. Well, I guess the kitty wants to talk about catheters a little bit. Hey, kitty. And trust me, folks, this is so unusual. This cat never gets on me. Well, you going to the beach. She loves Fisher. She loves her bish. Anyway, the positives to the Foley catheter are, obviously, it is indwelling. If you don't have good hand function to be able to use ICs, you can do that. That also gives your caregivers, or the ability to just empty it maybe once or twice a day, depending on your output. It gives you the ability, actually cost effective, to where that catheter stays in. Mine stayed in for 30 days, and I was real careful with my leg bags. They make different styles of leg bags for the Foley catheter, small, medium, large. So whatever fits your needs, that's available for you. The negatives to me is I got a lot of UTIs with it. And honestly, the two biggest negatives to me was it hurt because I had filling down there. And number two, they are kind of stinky. It's hard to keep them from stinking. And, I would always Lysol mine, whatever, have Fisher do that. He doesn't remember, but they are kind of stinky too from time to time. But understandably, like I said, at one time, because of my function not being back yet, I had to use them. And so they're a great option. So nothing wrong with the Foley catheter whatsoever. But I do believe the independence, when you move into the positives of the IC, is what it says. You can get away with shorts more if you're hesitant to wear a leg bag that shows, or you can, obviously it's a disposable, so once you go, you can get rid of it, dispose of it in the right place. And, obviously it would control the smell, like I just spoke about. Sex, again, is a big thing for folks after SCI. Life goes on, right, Fish?
Mm-hmm.
Life goes on. People, we're still alive. We still have the same needs. And if you're able and you have the function, go for it. And then my advice to you is this. If you have a Foley catheter, regardless of how long it's been, I would attempt. If you've ever thought of using ICs, I waited 4 years. They told me that it would be highly unlikely because they felt like my bladder would have shrunk too much. But, we've got to live. And if it's something you want to try, I wouldn't be scared a bit to try it. Not one bit. What's the worst that can happen? You just got to put the Foley back in after your trial period. So, nothing is ever concrete in the realm of SCI recovery. So anything's possible. And always keep pushing toward the moon is my advice, right, Fish?
Mm-hmm.
Right?
Mm-hmm.
And so, with all that in mind, like I said, after 2014, for 6 years, 6 years, I've been using a urinal. And now I have what I would consider just as good a bladder control as I did before my accidents. I really can hold my bladder. The only time that I have really bad accidents is if, like I would have before, if I'm really trying to hold it, if I'm driving or don't want to pull over, lazy, So, it's anything is possible. And I know I'm sure glad of my blessings. And I would encourage everybody that watches this video, if you have went through any of these steps using catheters, make sure and make comments in the comments below so other people can see them. Make sure that you tell maybe the positive and negative of what you've seen. This has just been my story, right, Fisher?
Yep.
And everybody's story is different. So make sure we really ask to put the comments below so other people can see, maybe what you've dealt with, what you've done that works. Because again, no two are the same. And Fisher, what do you want to add?
Make sure to like, share, comment, and subscribe.
See y'all.
I was almost about to sneeze there.